Good morning, YouTube family and friends. Hope you had a great week. My week was normal, whatever normal is. Today is Saturday, September 6th, 2025, and this is my week 76 of being back on Mounjaro while I deal with a host of medical issues. Yeah, let's go ahead and let's get the weight out of the way for you folks. Last week I weighed in at 236, which was a 2 pound weight loss. Well, the weight loss is continuing, and I don't know if it's a good thing or bad thing. I weighed in this morning at 233, which was another 3 pound weight loss. So that actually puts me at a -3 for the 76 weeks of being back on Mounjaro. Yay, I'm finally in the negative. Yay. But I don't know if it's a good thing or not. So that is 8 pounds I lost in 3 weeks. And I'm not really trying to lose weight. I'm on medication from the psychiatrist, and I think that's affecting it. So I guess I am doing a little bit. I am going for a walk every day to help when I get in a head spin. My therapist says it's good to go for a walk to try to clear your head, clear your thoughts. So, but yeah, and I also, this week, I had my first 2 sessions at the YMCA for my water physical therapy. Uh, yeah, the my uh, physical therapist that works with the CHI works with Dr. Chen, my neurologist. Uh, no, I think I said this last week. He confirmed that I have weakness in my right arm and my right leg. So we're doing water therapy where he has me in the therapy pool. Oh my God, it's like a sauna in that room with the therapy pool. But he has me doing a bunch of different exercises. We're trying to strengthen my muscles, including my core muscles, try to help out the weakness. And when I get unstable, I'm sorry, I'm, what do you want to call that? Oh, I lost the word for it. Tremors. I wake up with tremors every day now, and they last quite a while. Sometimes they're visible and sometimes they're not. They're a little visible today, but a lot of times it's just I only feel them internally and you can't see them. But I am trimmer. I just got out of the shower and that was hard because my legs are feeling tremors, and it makes me worried I'm going to fall because of the tremors. But no, my psychiatrist adjusted the medication this week because I saw her also this week because she was testing their medications out for 11, 12 days, something like that. And so I saw her, so she tweaked it a little bit. So let me go over that right now. She's treating me for severe anxiety and depression. Uh, so the first one is I take this every morning, just one. It's venlafaxine, ER 75 milligrams. That's VENLAFAXINE, then ER and 75 milligrams. So I I don't know if this is the one that's causing me the tremors or not. And then at night, I'm taking 50 milligrams of hydroxine, HCl. That's HYDROXYZINE. So hydroxine. So that's also all this stuff is for anxiety and stuff. And so this makes me tired, but my body is really sensitive to medications, and so I get tired. I get fatigued real easy, and it seems to last in my system quite a while. So That's why I'm not able to haven't been able to drive Uber for a couple months now, which is killing me financially, which is adding more stress to me. And then now to help, I also get really bad dry mouth with these medications. Really bad dry mouth. I'm getting weird dreams. So, and I'm also, my acid reflux is coming back now. I take omeprazole for my acid reflux, and it's controlled it for many, many, many years. Well, now I'm starting to get acid reflux again. And so I need to send a message to my primary doctor to ask her if we need to up that medicine, omeprazole medicine, to calm down that acid reflux, because I got that varices in my esophagus from my liver cirrhosis, and I don't want that acid reflux acid to eat away and make that skin around that varices weaker, so it could potentially burst and I bleed out. I'm worried about that. So that's something else for my head to worry about. Oh my God. But anyway, the third medication she has me on that I take once a day is 1 milligram of lorazepam, and that's Lorazepam. Lorazepam. I think this stuff might be under the narcotics category, maybe. One of these is under the narcotics. One of these three is under the narcotics because I had to show my ID to get my prescription. So one of them is a narcotic. That doesn't make me too happy, but I'm doing what the shaky. Oh, it's the tremors. I hate tremors. I hate tremors. I hate tremors. And I haven't been sleeping well at all this whole week. I keep waking up. Last night wasn't as bad as the last few nights, but I still continue to wake up. This damn sleep apnea, and this Inspire device is supposed to help that, but I'm wondering, 'cause I'm still awake when it comes on, because it's on a half-hour delay when I turn it on, so I'll have time to fall asleep, and I'm not falling asleep before that. So it's like it's really strong and powerful when it first kicks in, but when I wake up at night, it's like I can barely feel it. So I'm worried that it's losing the effectiveness as the night goes along, because the tongue gets weak because of my generalized myasthenia gravis. And so I'm wondering if it's less effective as the night goes on, because it stays on for eight, eight, 8.5 hours. So 8 hours, half hour delay, and then 8 hours it runs unless I turn it off. And so I'm worried that the effectiveness of it wanes the longer it's on, because the tongue muscles are just getting overworked and the myasthenia gravis is coming into play at that time. So uh, when I had a couple of weeks ago, when I had that like 3 or 4 weeks worth of tongue fatigue, I had a flare up of it. No, I had trouble chewing, had trouble swallowing, and I had trouble talking. For the most part, the talking has resolved itself. My tongue is not as weak, so I can talk for the most part okay. Chewing, it's better. It's much better, but I still get it a little bit, especially with drier, crumbly food or foods I have to chew a lot. Then I can have that loss of muscle movement in my tongue. But I'm still having the swallowing issues. And it's not that the food's getting stuck in my esophagus. It's more it's getting stuck in the back of my throat. It's like I'm not swallowing all of the food at once, especially with the dry, crumbly food. So like when I swallow, part of the food is still in the back of my throat, waiting to be swallowed. And so it's like that's why it feels like I have to swallow 2, 3, or 4 times to get that feeling of food still being back in my throat, waiting to be swallowed, to get it to go down. So that's scary, because if the food just sits back in the back of my throat, it could very easily go down the windpipe and not the esophagus. And so that's scary. So I'm still dealing with that. But at least I'm not having trouble talking anymore. But it's a flare up. It was bad flare up that hasn't resolved fully, and that might be because I'm using the Inspire device. No, my tongue's getting weak. So, and I think I told you last week, my HR at my job has given me a deadline to come back to work or have paperwork filled out to see to request further accommodations, which means continue to be on leave. My FMLA is over, expired. Not expired, but I used up my full 12 weeks allowed this year between the two surgeries, and this time I haven't gone back to work. I haven't been back to work since my surgery date of June 9th. So it's going on, next week will be 3 months of not working. I'm still getting full pay because I was maxed out on sick leave going into the year. So I still got like almost 60 days of sick leave built up that I'm using. So I'm still getting full pay as of right now. But they wanted this paperwork filled out for additional accommodation and for me to be able to stay on sick leave or come back to work. Well, as of right now, I'm not ready to come back to work. There's anxiety and depression. It's like something new every day. Like this week here, the new stuff is the acid reflux and this medication. I'm definitely not coming back to work while I'm still dealing with the side effects of this medication that the psychiatrist has me on. With the daily tremors that last 3, 4. Lately, it's been lasting till at least 1 or 2 o'clock in the afternoon, and I can't focus. I can't. There's no way I can focus on doing a job while I'm having the tremors, and I definitely can't drive my car for Uber when I have these tremors. So it's like, oh my god, there's dry mouth constantly. I'm constantly. The good thing is I'm drinking tons of water because this dry mouth is crazy. Right now, I'm talking. I got. You can see on my tongue how dry it is. That white stuff. How dry it is. I just took a shower. I just brushed my teeth. That white stuff is the dryness kicking in. It's like cotton mouth. It's crazy. So, and I'm not sleeping well. So I need to get this. I need to get this Inspire device at a level to where it's actually working, so I can get a full night's sleep and see if that helps the fatigue. But I can't even do it when I go for my walk. When I get back, I'm tired. My legs are tired. When I do my physical therapy in the water pool, I just get tired because my legs are shaky right now because I had my therapy session yesterday, and then did a lot of walking around getting groceries, and then I took my stepmom out last night, and so I did a lot of standing around last night. And my legs are shot today. I think that could be part of the reason why they're so shaky this morning because I just way overdid it. But usually, during the week, if I just go for my walk, that's usually half hour to 40 minutes. I come back and I have to take a nap. I usually sleep for about an hour, sometimes 2 hours, which could be one of the reasons why I'm having trouble sleeping at night because I'm sleeping during the day. But no, I have to. I can barely keep my eyes open. I'm so fatigued. And so I don't know, the fatigue is the myasthenia gravis fatigue. Is it the fatigue from this medication? Because I know some of this medication is supposed to help me sleep, so it makes me drowsy. So is it from that, or is it from my sleep apnea? Because, oh my God, it's just, I don't know what's what. Oh, that's why I can't work right now. And I'm not going to be able to, I don't think I'm going to be able to go back to work by the 15th. So I need that. I have to fill out a form, and then they need my medical provider, to fill out the form. Well, I talked to I did talk to my therapist about it because I saw him yesterday as well. No, I saw him Thursday. No, I saw him yesterday. No, Thursday. Yeah, yeah, I saw him Thursday. But my psychiatrist said that she doesn't fill out those forms until she has seen and treated a person regularly for at least 5 or 6 months. So she won't fill out the form. So she recommended that my neurologist fills out the form because he's been seeing and treating me for my myasthenia gravis for over a year, and my anxiety and depression is mainly stemming from that disease, even though it's a combination of all my medical issues. Sorry, I lost my balance there. So, but so I was like, what am I gonna do? Because I don't know if he'll fill it out. He's on vacation. He was on vacation this week, so I gotta send him a message for next week and see if he'll fill it out. But I'm panicking here because if I don't get that filled out, then there's a very good chance that that since I won't come back to work yet, that they're going to fire me and I'm going to lose my benefits instead allowing me to stay on short-term disability until at the time I'm able to come back to work in a new position. I would have to apply for a new position. If they fill my position after the 15th, they'll post it, and then if they don't come back by the time they fill it, then if I want to come back, I have to apply for an open position at that time. Or I go on long-term disability in December, which I have to be approved for that. So like I'm panicking here. What am I going to do? So I sent an email to Becky, who's the HR person I've been working with. I let her know what's going on. I told her that I'm still not ready to come back yet, but my psychiatrist says she won't fill out that form until she's seen and treated me for a period of at least 5 to 6 months. She recommended that I have my neurologist fill it out, but he's on vacation right now, and I don't know if he will fill it out. So what happens if I can't get that form filled out by a physician? So I also asked her if my primary doctor can do it, because I know before the FMLA form had to be filled out by a specialist, and not my primary doctor, not a therapist. So, but thankfully she came back and she says, no, we're just looking for information so we can make a determination on what to do going forward. If we allow you to stay on medical leave or pretty much terminate if I don't come back. So I got a little relief off of that. So I called up the business where I see my psychiatrist and therapist, and I asked them if I could just get like a letter from the psychiatrist and my therapist, just noting, confirming that they are treating me, what they are treating me for, and just a little information that so I can give that to my employer. And they said no problems. They were the lady I talked to said no problem. So she was going to ask my psychiatrist to do the letter. I know the psychiatrist said she wouldn't fill out any forms, but this is just a letter. Not asking her to say yes, he can't come back to work. It's just a letter stating that yes, I am treating him. Yes, a therapist has seen him and is treating him as well, or is working with me. She's treating me on the prescription side, and my therapist is working with me on the mental side. So it's just a letter confirming all that, confirm the diagnosis of what she has so far. So I'm really hoping she does that. Hopefully, they're just going to email me that letter once they receive it from the psychiatrist. So, and I'm also if my neurologist won't fill out that form, I'm gonna ask him the same thing. If he can just get complete a letter confirming that yes, I am a patient of his, what he's treating me for, and whatever those aspects they can add to it. Just so I have something to give back to my HR department so they can make a final determination of whether, yes, we're going to accommodate you by allowing you to stay employed and stay on medical leave using my sick leave. That way I can keep my benefits, keep my pay until we get to the 180-day mark. My work, it's 180 days of being on short-term disability until it can turn into long-term disability. They said that they're counting the start day of June 9th when I had the surgery. That's when I started to be out and haven't been back since. So that's their start date. So 180 days will be roughly December 9th. So they told, like I had my meeting with HR a couple of weeks ago. They stated that no, if I'm still on medical leave come in October, then they would give me the go ahead to apply for long-term disability. That's through the insurance, that's through MetLife. So they would give me the okay to start that process of applying for long-term disability. And hopefully at that time, if at that time I'm still not back at work or whatnot, hopefully I would be approved for that. Then at that time, if I do get approved for long-term disability, then at that time I would be terminated from the company, but I would be on long-term disability and I would get 66.67% of my pay, which would be helpful at that time. Because at that time, then I would be terminated. I would have access to my 401k where I can pull some money out to pay down some bills so I can make what I get on long-term disability work. My mouth is so dry, so yeah. But like I said, I would not have insurance at that time, no medical insurance, so I would have to sign up for the Affordable Care Act or whatever, sign up for some type of medical plan, so I would have medical coverage. At that time, though, I would apply for SSDI, it was a Social Security Disability. So I know that's a process that can take a while. Before I would apply, I would definitely get an attorney that works with disability to help me with that process. So, but that's all if I can't get back to work. As of right now, I'm not going to be able to get back to work, I think, by the date of the 15th. So, but hopefully within another month or two, I can get these side effects under control. Once my body gets used to this medication, hopefully the tremors will subside. Yeah, my legs are still tremoring right now. That's why I'm constantly kind of moving back and forth. I don't want to stay in one spot because I don't want to tumble over by staying in one spot. But they are shaky right now, so. But yeah, so that's the update. I'm hoping to be able to get to a point where I think I can go back to work, but it all depends. I have to have these side effects better. I can't be tremoring. I can't have this dry mouth. I gotta be able to sleep better. And then just my head. No, the anxiety from just all these medical issues. I need to have a 6-month ultrasound done next month for my liver disease, my non-alcoholic fatty liver that's turned into liver cirrhosis. I get an ultrasound done every 6 months, so that's coming up. I need to contact my gastroenterologist to ask her to submit that request so I can get that 6-month ultrasound done, so I can see where all that looks like. So yeah, and hope that my tongue doesn't get worse again, or my arm and leg weakness doesn't get worse. Hopefully that's what the physical therapy is for. But the myasthenia gravis, you take it day by day, hour by hour, minute by minute. You just don't know when you're going to have a flare up of muscle weakness. So, and that's the biggest anxiety part of it and depression part of it. You don't know when it's going to be good, when it's going to be bad, when it goes bad, how long the bad's going to last. And then on top of that, I got to worry about my liver, trying to keep my liver healthy. Though the treatment for my myasthenia gravis right now is steroids, and being on a long-term steroid, it's not good for your diabetes because I'm type 2 diabetic and can cause you to gain weight. And gaining weight is not good for my liver. Having my blood sugar go out of control is not good for my liver. So it's like, So, okay, well, this video is 24 minutes long. So I need to take my Mounjaro shot, 7.5. Remove the protective cap. You can see the liquid in there. Move it to the unlocked position. I'm going to throw it in. You can go in your fatty part of your arm, your belly, or your thigh. I like to do my gut. I did it on this side last week, so let's do it on this side this week. Has to be at least 2 inches away from your belly button. I just showered, so I'm nice and clean. See that green plunger go in and out? It's that simple. Little blood drop at that time, so I hit a little bit of a blood vessel, but it ain't bad. All right, folks, if you made it this long, it's going on a 25 minutes video. So if you made it this long, I sure appreciate you listening to me. These videos really help me out. It just helps me talk about it. It's kind of like my diary. These videos are kind of like my diary. So, if you made it this long, I really do appreciate you. And if you would hit that like button, and if you're not already subscribed, go ahead and hit that subscribe button. And then you can click on the notification bell so you get notified when I post my weekly videos. Usually it's just one video a week. Sometimes I'll post a midweek video, but usually it's just one video a week. So, all right, take care, everybody. Remember to live life to the fullest because you don't know what's going to come at you. So I appreciate every one of you. I love you all. Have a good one. Bye-bye.